morning, friends, and welcome to this second uh, neuroanatomy. Last week, we looked at how the nervous system was. Today, we're going to take a step back and see how this was formed. It's a discussion aspects. When I was putting this together, trying to size the depths of embryology, and I had quite a few points there which looked at definition of all the statistics around them, and also around the healthcare and economics supporting them. I realized, no, that's not really. I'm studying embryology. I study embryology because, and it's beautiful because it's there in the structure. The CT scan of the brain. You see the normal anatomy. And just because it's there in your back garden, it's there along the paths of your garden, and it's and appreciate the beauty of let's get it as a journey. We start the journey functions. In effect, actually, we are looking at the journey in a reverse way. We are seeing actually the brain trying to understand how it moves from that single cell organ. In effect, it's actually biography of cell, the zygote, then develops mechanism. And it is very much akin to the stages that we have as born, the phase of childhood, teenage years, adolescence, and the grown up. Similarly, these cells go to shape their final destiny. There are guiding hands, and there are guiding hands for us, parents, the aunts, the neighbors, the policemen. Sorry, just excuse me for a minute. From your answer. Just excuse me. Apologies, I've been told that the audio was breaking. I hope this is a little bit more clearer. Still getting used to this technology between trying to speak and advance the slides. And perhaps the audio on my laptop is not brilliant, but let's carry on. Okay, so I was saying we are going to see the hands that shape the destiny of these nerve cells as they reach their final destination. We're going to see how the patterning occurs within these. Also, we will see when they develop problems during their destiny? What are the scars that are left behind before they reach their final destination? So that is going to be the gist of this discussion today. So let's look at all of these. These guiding hands and the patterning that happens in the background, and that occurs at all the stages. And just emphasize on that. Okay, so what are the various stages that we're going to look at? The stages that we're going to look at are the early embryonic stage, between the first 6 weeks, the subsequent fetal stage, which carries on up to 24 weeks, and then the perinatal period, which probably is not the domain of this discussion. So I'll probably concentrate more on the embryonic and the period of journeys. Let's start with the early embryonic period. So we know that the story starts during fertilization, and we get the single cell structure which starts dividing into very soon within the first few days, and by the 4th or 5th day we reach the stage of morula. The morula is nothing but a 30 cell structure like a bomb, and eventually it is going to implant into the uterus. At the stage of implantation, it is a structure called as a blastocyst. Blastocyst is nothing but this morula which has now cleaved, so that there is a fruit-filled structure, the blastocoele, if you like, and all the cells are now congregating towards one end of, and this is the inner cell mass, and this inner cell mass is the one that is going to form the later on embryo, while the cells which are outside are going to help implantation of the embryo into the uterine wall, and it's going to form the placental structures and so on and so forth. So let's start concentrating on this inner cell mass. Okay, so the inner cell mass fairly soon will divide and form this bilaminar structure. So if we were to remember, there was the inner cell mass with the congregation of cells, and these have now started to align themselves into layers. And for this to happen, there are a multitude of proteins that are secreted by the adjacent cells, which ensure that these cells are not only in one single layer, but also forming a special distinctive pattern to themselves. More about these patterning and the morphogenetic proteins, as we call them, which will come later on. This bilaminar disc layer has at the top what we call as the epiblast, and the bottom layer is the hypoblast. And this top, which is the epiblast, is going to form the ectoderm, which the neuroectoderm is a product, and the inner one is the hypoblast, of which endoderm is the product. And this is just a zoomed view of this area over here. You can see the epiblast, which forms the ectoderm, and the ectoderm actually invaginates inside to form the mesodermal cells, which are formed by replication of this ectoderm. So now, from a 2-layered structure, you can see now how we are getting into a 3-layered structure. And it's important because these 3 layers are the ectoderm, the mesoderm, and the endoderm. Ectoderm, which is going to give rise to the nervous system and the spine, the end and the surface structures. The mesoderm, which will form muscles, the bones, the connective tissue surrounding them. So in fact, the skeletal system, the musculoskeletal system, which will surround the developing nervous system. And finally, the endoderm, which will form the respiratory and digestive tract, which will be on the ventral aspect. And this segregation that occurs because of various patterning and morphogenetic proteins is very, very essential. Because if not, it's going to give rise to problems. So here is a diagrammatic representation of a mishap that has occurred in these early stages, where this is the inner endodermal layer, the ectodermal layer, and they're developing neural structures in here. Because the segmentation has not occurred, we can get tracks which develop between these two, and there are a host of different abnormalities that are described, right from the tracheoesophageal fistulas to the bronchogenic cysts. And here we have a neuroenteric cyst, which can be seen inside the spinal cord, on the ventral surface of the spinal cord, or sometimes within the vertebral bodies or in the paraspinal location. And if you look carefully, sometimes we can see the associated vertebral anomalies. So this is a failure of disjunction. We are still in the embryonic period. First step was the formation of this 3-layered embryonic disc. Now we look at this concept of dorsal induction, which is basically inducing the dorsal structures. And again, we have got this bilaminar disc over here. On top, we have got the epiblast. Underneath is the hypoblast. The yolk sac is going to be here, the amniotic sac at the top. See what's happening here at first is this thickened ridge, what is called as a primitive streak, which develops on the surface of the ectoderm. And this streak is very, very essential for the development of the notochord, which of course is a prerequisite for the development of the entire nervous system. So here we have a primitive streak which starts at the tail end and stops more or less than halfway through at a pit called as a primitive node. And this primitive node is somewhere which triggers the formation of the notochord. You will see in the next slide over here. This is the notochord which is in formation. This is the trilaminar disc layer with the ectoderm, endoderm, and the mesoderm in the middle. But the cells of the mesoderm right in the middle over here form a very specialized structure called as a notochord. And the notochord is very, very essential to subsequently manipulate and determine and direct. It's like the orchestra master which will direct what happenings on the surface of the. So going back to this primitive streak over here, this was the primitive streak which was the specialized organized cells on the surface, and from the primitive streak at the end of it we had the node, and from the node we had this development of the notochord which went towards the cephalic end. In front of it we have got the endoderm and the ectoderm which meet together, and that's the oropharyngeal membrane round about here, and similarly at the back end we'll have the cloacal membrane. If you look in the transverse section now, so this is what is happening as a derivative and excitation by the notochord. So notochord is now inducing the ectoderm on the surface by special morphogenetic proteins to form this neural plate, which is nothing but with the thickening of these cells on the ectoderm. These thickened cells start to fold now. They rise and fold. So you get the neural folds, the neural groove in the bottom of these folds. And these neural folds, you can see how they start to approach each other. And finally, they join up to form this neural tube. These special cells which are trapped between the neural tube and the surface ectoderm are the neural crest cells. More about this a bit later. So this is what we end up finally with. You have got the neural tube in the center. You've got the notochord, which really in adult is only a vestigial structure. You've got the neural crest cells on either side, and the surrounding mesoderm, which was a derivative of the ectoderm. This mesoderm is going to house the neural tube and is going to be responsible for the formation of the vertebral body, the paraspinal muscles, but also the mesenchyme in which the cells for the future blood vessels are going to develop. The neural tube, of course, it's open to start with, but it starts zipping up and it starts closing both at the anterior and the posterior end, forming the neuropores. These neuropores usually will fuse by around 3 to 4 torvi. So here we have now the neural tube which has formed. We have seen the neural crest cells which are on either side of the neural tube, and these are the ones which are actually responsible for development of the entire nervous system. So from the neural tube we have the central nervous system, the entire brain, the spinal cord. We get the ventricles within it and the central canal within the cord. The neurons which are developed from the neuroblast cells which are lining the neural tube, and then we have got the glioblasts which will develop them into the neuroglia of the future. So that's how the central nervous system will form. The neural crest cells actually is responsible for the development of the entire peripheral nervous system, including the cranial nerves and their root ganglia, as well as the autonomic nervous system, the sympathetic and the parasympathetic chains. Also, it's important to mention that the chromaffin tissue within the adrenal medulla and the glomus cells within the carotid bodies are also formed from the neural crest cells. The neural tube, yes, it zips up completely, and if it does not, then we get into these anomalous situations where the anterior neural pore, if it doesn't close, we get a condition of anencephaly, and if the posterior neural pore doesn't close properly, there is a host of abnormalities, one of which here I've shown is the meningocele at the lower end of the spinal canal. We have seen now the early stage of the trilaminar disc. We have seen how the dorsal induction occurs because of the notochord and the changes within the neuroectoderm to form the neural tube, how the neural tube closes. The next step, embryonic step, is this ventral induction. Of course, we talk these as steps, but these are happening simultaneously. This ventral induction is really right at the top end, the cephalic end of the developing embryo. And what happens is we get these vesicles. The neural tube is now going to form three specific primary vesicles. We got the prosencephalon, which is going to form the forebrain, the mesencephalon, the midbrain, and the rhombencephalon, which is going to form the hindbrain. Not only do we get these tubes, which are differentiated into these vesicles, we get three specific flexures which are formed. We have got the midbrain flexure, the mesenchymal flexure. Then we get the pontine flexure, which is at the level of pons, and we'll see that a bit later on. And then the cervical flexure at the junction of the cervical cord and the medulla. From these primary vesicles, we get secondary vesicles. So you have got from the prosencephalon, we've got the telencephalon, which are like telescopic tubes which project out from the prosencephalon, from a central diencephalon. And you can see these are the developing eyes from the prosencephalon and the central diencephalon, which stays in the middle. But from there, you get these optic vesicles. So the optic vesicles are nothing but a outgrowth from the diencephalon, and that explains why the optic nerve has to relate in the thalamus, because it is nothing but purely an extension of the diencephalon. Similarly, the developing ear, the otic capsule comes from the pons, the metencephalon, and hence the cranial nerve nuclei responsible for hearing are located there, and the 8th cranial nerve is nothing but an outgrowth of the metencephalon. And these are the flexures that we were looking at earlier on. So you've got the mesencephalic or the midbrain flexure over here. The pons, the pontine flexure, is actually a reverse one, and that is responsible for the bulging belly of the pons that we see on the sagittal MR scan. And then we have got the cervicomedullary flexure at the bottom end. And these ventral induction is responsible for the normalization of the two hemispheres, the two halves. And of course, if there are any problems with them, we are going to get many midline abnormalities. And I've named some of them, and I've shown you an example of one of them, which is septo-optic dysplasia. This is a normal brain structure here, the two halves of the brain, the two lateral ventricles, and the midline septum. And of course, this patient has not have an septum condition called as absence of septum pellucidum, which can be seen in septo-optic dysplasia, which can be seen in associated with very many other abnormalities, including those of the optic tract or of the pituitary gland. Okay, so now we move on to the next step, which is the step of the cellular proliferation and the migration, which we are now in the fetal period of embryogenesis, or rather of development. We are beyond the embryonic period. So how does a single cell which is lining the margin becomes a specialized cell? So what is this concept of cell determination and differentiation? So if you look at the neural tube, initially you have got a central canal lining of the cells, and these proliferate over here, we saw, and they form this mantle cell layer, and beyond that is the marginal cell layer. But all of these cells, it's important to figure out how they then distinguish themselves, how they differentiate themselves to form the astrocytes, the oligodendrocytes, the other glial cells, the neuronal cells, and what determines that. So we know that the zygote is totipotent or pluripotent, so it can form into any cells. And cell determination is a process by which this unspecified cell will choose a path that it has predetermined. And when it starts undertaking that path, it is called as cell differentiation. So to give you an analogy, let's say someone is at a GCSE or a A levels, and they decide they have predetermined that they're going to choose medicine as a career. So they're going to start learning about biology, about chemistry. So they have chosen to take up that path. But the actual process, the differentiation will start once they register to the medical degree curriculum. Once they start learning about the anatomy, about the physiology, about the biochemistry and pathology, so on and so forth. So that is the differentiation. When the cell takes that path, it is starting to differentiate. But before it does that, it needs to predetermine what path, and that predetermination and differentiation is very much regulated by these special proteins called as ligands. And we saw earlier on how notochord induces the adjacent ectoderm, how the bilaminar, how the inner cell mass will cleave itself to form the two layers. And that is nothing but a concept of ligands which will enable cells to come together, to form together, to grow together, but at the same time, they will turn off some of the expressions, and hence some of the neuroectodermal cells will turn off the expression of the cutaneous ectoderm and will not form the ectoderm but will form the neural structures. And some of this is also helped by induction of the adjacent cells. So this is the concept of cell determination and differentiation. And as I said, this is helped by morphogenetic proteins, which are nothing but the helping hands, which are secreted by cells into the extracellular space. When these helping hands then trigger off a receptor on the cell surface, which secretes a transcription factors, which goes and activates the DNA within the nucleus. And these proteins are called as morphogenetic proteins, and there are hundreds of them. And not only are they exciting these surface cells on the surface pathways on the growing cells, they are also inhibiting the adjacent ones. So the concentration of these morphogenetic proteins at a particular site is important, but it's also important to realize that the more further away the cell is from these morphogenetic proteins, it is going to be less influenced by it. And what do these proteins do? They allow cell-to-cell adhesion to occur, and that explains the concept of this bilaminar and the trilaminar disc. They also change the extracellular matrix, and hence they induce the mesenchymal change. They will induce the formation of the sprouting blood vessels. They will induce the formation of the vertebral bodies surrounding the growing neural tube. Not only that, they will alter the shape and the size of the cells. So a small cell, a round cell, will start developing structures like the dendrites, like the axons, and they will start stretching a long way out. So you have got axons which will start from the motor strip and go all the way down the pyramidal tracts into the spinal cord. So this is how the morphogenetic proteins which are secreted locally will influence the growth of the cells, will influence how they arrange themselves, will influence how the shape and size of this cells changes. And this is just a more detailed description of the same. So a zoomed up view of the ectoderm over here. This is the notochord. There is going to be endoderm underneath here, which I have not shown, and the surrounding mesenchyme or the mesoderm. And because of these proteins, and one typical one of them is called as a sonic hedgehog, and you'll keep reading about this at various times. It influences the developing ectoderm to fold. Not only does it do that, this notochord releases a sonic hedgehog, and it influences the closest part of the neural tube. And the closest part is the ventral part. It is the basal part and the foot plate, the basal part and the foot plate. And this induces it to form the sensory cells. Whilst the other morphogenetic protein called as a Brown morphogenetic protein, which comes from the more lateral ectoderm, is going to influence the more dorsal part or the alar plate, as it is called as. So this is the neural tube. The more dorsal part is the alar part. The more ventral part is the basal part. The basal part is influenced by the notochord and its secretory sonic hedgehog to form the sensory neurons, whilst the morphogenetic protein by the BMP and the slug, these are all proteins, they influence the dorsal part to form the sensory neurons and the neural crest cells, which will form the sensory ganglia. And this is probably a very important slide to try and understand, because most of the subsequent discussions of embryogenesis that occurs is going to be based on this. So you can see how the ventrally located notochord influences the ventral part of the neural tube, and the more further away you are from the notochord, the less influence the sonic hedgehog is going to have on this, and hence we do not have any motor fibers coming from here because the sonic hedgehog cannot influence that. And not only that, the BMP and the slug which are secreted here are going to actively suppress the sonic hedgehog expression here, and hence even though sonic hedgehog molecules may try and reach, they are superseded by these other protein molecules which will influence and form the sensory ganglia. So this is the basic structure of the spinal cord over here. And just to see what we were talking about. So this was the neural tube over here, the ependymal margin, then we had the mantle layer, and then we had the marginal layer. So the mantle layer has already started to now segregate itself into the dorsal alar plate and the ventral or the foot plate or the basal plate as it is called. And from this basal plate we'll get the motor neurons, and from the dorsal plate or the alar plate we're going to get the sensory neurons. So this is how the patterning occurs. This is how the localized patterning has already started to occur within the spinal. And this is just to show you a more broader perspective of the same. You have got the neural tube with the neural crest cells over here. The neural tube is going to form the spinal cord, and the ventral aspect of it is going to form the motor root, and the dorsal aspect is going to form the dorsal root based on the influences of the local morphogenetic proteins. The dorsal root ganglion actually is from the neural crest cell. Similarly, the sympathetic ganglia are derived from the neural crest cells. So you can see a spinal nerve is purely derived from the neural crest cells, whilst the central nervous system is derived from the neural tube itself. Okay, so from the spinal cord, let's just take a step higher up. Now we are going to move towards the medulla oblongata. So the medulla oblongata is very similar in its anatomy, and it's very fundamental to have understood this concept. So once we understand the concept of the alar plate and the basal plate, we take a step further. So imagine we were to place a tube, your fingers inside here, and splay apart these two alar lips. And you can see the alar lips are now much more lateral, and the basal plate is much more ventral. So, and this is what is the structure of the medulla oblongata. In fact, this is what is the structure of fundamental structure of the brainstem. You've got a fourth ventricle over here. You've got the alar plate, which is much more lateral, and the basal plate, which is much more ventral and medial. And we saw the more ventral. So if I were to just go back here, the motor neurons were anterior, the sensory neurons were lateral, and as we come up, the sensory neurons are more lateral, the motor neurons are much more medial. And there we have the somatic nuclei of the visceral, as well as the somatic motor cells, which are more medial, whilst the more lateral cells are the sensory cells. And this pattern stays throughout in the brainstem. So you have got the 12th nerve, the facial nerve, the oculomotor nerve complex, all of which are the motor nerves, which are more medial, whilst the cochlear nerve, the vestibular nerve, which are more sensory nerves, are going to be more lateral. So you can see the same pattern that develops within the brainstem as is in the spinal cord. So what's the cerebellum? How does cerebellum develop? To look at cerebellum, you have to try and understand the structure which is happening at the level of the pons. So the pons is developing from this metencephalon over here, and that's the fourth ventricle. We have got the more ventrally arranged plates, which are the alar plates, which are lateral, the basal plates, which are more medial. These are the motor neuron structures. These are more the sensory. But what happens is these more lateral alar plate, the cells start to thicken, and the cells start to thicken, and they form a lip, what we call as a rhombic lip. And this is what it looks like on the coronal view. Imagine the cerebellum has been taken out from either side, and we are looking just at the back of the pons and back of the medulla. And this is the rhombic lip from which the cerebellum is going to develop. And the midline, of course, is the vermis, and the lateral are the cerebellar hemispheres. And these cells which are developing start migrating. They migrate laterally and they migrate medially. And these medially migrating cells are going to form the cerebellum and the cerebellar. And here we have again the same slide where the rhombic lip is going to form structures which are going to develop into the cerebellar cortex. Over here, you can see as they start migrating more laterally, you get the cerebral cortex and all the cells of the cortex, and the cells that do not migrate over here. And you can see this is again the axial diagrammatic representation. This is the area of the rhombic lip. When they start migrating more laterally, they form the cerebellar cortex, and here more medially they stay in the midline. The cells do not migrate sufficiently, and the deep cells, the deep cerebellar nuclei are located in this location, and we typically know that the dentate nucleus is located in this location, and this is a patient with a FAR syndrome showing calcification within the dentate nucleus. And the cerebellar organization is very akin, very similar to the brain organization, in that you have got two hemispheres, you have got a cortex outside, and you have got a deep nuclei. You have got a cerebellar nuclei here in the brain, in the supratentorial compartment. We have got the basal ganglia or the basal nuclei. So we are still moving up. We have seen the organization at the spinal cord level. We have seen the organization of at the level of the brainstem. We have seen how the alar plate and the basal plate differentiate. So let's see how that affects within the growing brain itself, the growing cerebral hemispheres. Well, we looked earlier on how the telencephalon is formed, and how from the telencephalon you have got the olfactory bulbs and the optic bulbs, which come from the prosencephalon and the diencephalon itself. And the same holds true for the prosencephalon as well. So this is the neural tube over here. Remember, because of the flexure, it is now flexed. We have got a flexure at the level of the midbrain, and so dorsally we are going to have the alar plate, and ventrally we are going to have the basal plate. It's the alar plate which actually gives rise to the cerebrum and the most of the corpus striatum and thalamus. So this is a coronal view, if you like, and this is the dorsal or the alar plate, which is going to give rise to all the parts of the cortex. The oldest cortex, which is the archis cerebrum, from which you're going to get the hippocampal derivatives. Then the laterally, which is the neocortex, which is the overgrowth of all the superolateral hemisphere of the brain, and a much more medially placed paleocortex, from which we get the olfactory apparatus. So this is the developing cortex itself. The derivatives of the basal plate are still uncertain in the cerebrum itself. And when the cells are forming, they're going to form the axons and they're going to form the dendrites. And these axons are going to be influenced by the surrounding developing cells. So not only these axons will be traveling from front to back, but they will be traveling from side to side, depending upon the influences of the adjacent nuclei. And you get thickening of these commissures. We saw the commissures, the white matter tracts last week. We discussed about the various commissures, the corpus callosum being the largest one of them. And this is what gives rise to the thickening of these commissures and the formation of these commissures. So you've got the corpus callosum, which is the thickest of the commissure, but you also have the smaller ones, the habenular and the posterior commissure, and also the interthalamic adhesion that we do not see in this mid-sagittal plane. And here is a patient who has developed an anomaly where this has not occurred properly. The corpus callosum is a very rudimentary structure in this patient, whilst here it is completely absent. And we are seeing the telltale signs of this absence with the abnormal morphology of the vertebral body. So moving on to the next step of embryogenesis in the fetal period, which is the neuronal migration. And it's important to understand this concept, because we know that the neurons actually form in the surrounding the central canal, the neural canal, and from there they have actually got to reach the cortex, because neural canal in the adult is basically this is the ventricle, and we know that the ventricle is lined by ependymal cells, but from there the cells have to reach up to the cortex. And not only do they have to reach there, but they have to mature and they have to differentiate themselves as they migrate along those paths. So here is a coronal view of what's happened. So this is the level of the ventricles, and then the subventricular zone. This is where the neuroblasts are located, and they start migrating, and they migrate not only in a radial fashion, but when they reach the destination, they will also migrate tangentially to the cortex. And this is the process of migration. The process of migration, it's a fairly interesting, beautiful process. and I've tried to show you how that occurs. So here we have got the cells right in the center from the ventricle, and this is just a section of that as to what happens when they migrate. So before they migrate, we need to have these radial glial cells. So the glial cells are also developing at the same time that the neuronal cells are developing. So these glial cells are a scaffolding along which these neuronal cells, these red pink colored ones, are now using as a scaffolding to climb along them to reach the outer layers of the cortex. So the glial cells are basically the guide wires that will help the migrating neurons to reach their destination right on the surface of the cortex. And once they reach there, they have to then realign themselves and they have to group themselves so that they can perform that specific function. And this is the process of migration really. This is a single neuron. There are two ends to the neuron. You've got the leading edge, there is a trailing edge. Inside the neuron is a nucleus, and there is an armamentarium of various fibers and tubules which will help the migration of this neuronal structure. And if any of these internal structures do not develop normally, they are going to cause abnormalities within this migration of these neurons. So you can see the intricate structure within the neuron which has developed with the microtubules, the actin network that is within it, and these help migration of this neuron. And just to show you in the end, so this is the leading edge of the neuron, and these are the microfilaments within it. And what it does is the leading edge leads out, and then it pulls the nucleus towards it, and finally it pulls the back end of the developing neuron, and this allows the neuron to migrate along the glial fiber. So in the end, what we get is the cells which are near the ventricle over here. This is the ventricular zone, and these are the glial fibers that I've shown, and the blue ones are the neurons which have migrated using this scaffolding to reach and then organize themselves into this cortex. And of course, if there are any problems along this pathway, the neurons may not be able to reach the destination. And we call this terms as heterotopia, which is basically nothing but an abnormality where the location of the neuronal cells, and they can get arrested along the ventricles. You can get ventricular heterotopia, periventricular, or they can get arrested halfway through, called as the subcortical heterotopias. Just to show you examples of that, you'll see some of these patients presenting with epilepsy or developmental disorder. This is a coronal T1 weighted image, and you can see that the cortex is well formed over here. This dark layered structure. Underlying is a white matter, but beneath this white matter, you've got another band over here of gray matter. And this is because the cells which normally form here and migrate and reach all the way up to here have been arrested because they could not migrate and reach all the way to the top, and have given rise to this band of gray matter called as gray matter heterotopia. This is another patient where actually the arrest has occurred much earlier on. Here they have not been able to live. Some of course have left this layer and reached up to the cortex, but there is this band of abnormal gray matter which has not been able to do so, and this is periventricular or subependymal heterotopia. So once these migrating neurons reach the destination, they have to get organized themselves, and this itself is a very complex process, and it is determined by many pathways, of which reading signaling pathway is quite an important one, in that it targets the neurons that reach there so that they get recognized. They can recognize which are the additional neurons that are coming along. They can form adhesions with these, and it will stop the adjacent neurons to bind together, and so they can organize into the special areas which perform specific functions of speech, of recognition, of sight, or of hearing. So this is the process of the reading pathway, which then influences the local neurons to perform special functions itself. And of course, if these pathways are defective, this normal structure that we see here over here, so these are the migrating neurons. We have got the cells which have arranged neatly at the periphery here. This is the PL border, this is the surface of the brain. So not only they can arrest themselves at various stages, but also they can get they lose the normal architecture. They are mixed with other cells. Not only that, they are oriented in different ways. Normally the cells are oriented parallel to each other in a specific orientation, but this may be abnormally directed. Not only that, if they do not influence the surface of the brain, normally uh, there is an inhibitory process which will stop this developing neurons to overspill into the PL surface. But if that organization is interrupted, you get this overspill of the growing neurons onto the surface of the brain, and that gives rise to these various abnormalities of neuronal migration. I'll show you a couple of examples over here. This is a patient with tuberous sclerosis with focal cortical dysplasia. You can see the thickening of the cortex that has occurred, and that is because of abnormal organization of these neurons. Not only that, you can see the abnormality within the white matter, and that is because the glial cells are also abnormal, and they cannot produce the normal myelin that is supposed to give the normal appearance to the white matter tracts. And these are some other ones, other organizational anomalies here. You can see very abnormal looking cortex with hardly any sulcations. The gyri themselves look very, very bland as compared to this one over here. And you can see a very rudimentary Sylvian sulcus which is formed. So this is lissencephaly. Another one, a typical appearance of a cleft along the migratory path. This is schizencephaly, and this is a patient with what we call as polymicrogyria. Here you have got a very abnormal thickening of gray matter, which is adjacent to the Sylvian fissure. This is a perisylvian gyria that has occurred in this patient. So these are all migrational and organizational disorders that have resulted because the neurons which are supposed to migrate from the ventricular margin reaching up to the cortex could not do so for various reasons. What is the concept of neuronal patterning? I have sort of mentioned it a couple of times in our discussion in the last half an hour or so. So it's a process by which the cells that are developing, they will acquire fairly distinct identity for themselves, and that depends upon where position they are in. And I'll explain what I mean by that in the next slide. We talk of this concept of somites within the developing spine. Similarly, within the central nervous system, there is a concept of patterning which can occur in various axes. It can occur in the dorsoventral, and we saw that patterning where the notochord influenced the developing neural tube into the basal plate and the alar plate. So that was a form of patterning. Similarly, you can get patterning which can develop between the right and left axis, and we saw that in the patient who developed septo-optic dysplasia because he could not develop that midline septum. And also there are the anteroposterior patternings, and these are called as, in the central nervous system, these are the we call them. So we saw the ventrodorsal patterning where into the alar and basal plate. Similarly, we can call the rostrocaudal or anteroposterior pattern, which is called as the neuromeres or the rhombomeres. And this is a very important concept to understand because this will determine what are those specific group of cells going to perform the function they're going to perform at that particular level. And all of this patterning is actually governed by very, very specific genes. So for example, in the forebrain, you need these homeobox genes that are responsible for patterning of the forebrain. In the rhombencephalon, you need a specific group of genes called as a Hox gene, which will express themselves to form the specific structures of the rhombencephalon. And a slightly complex diagram over here, but just to show you this patterning that occurs not only in the midline, not only the anteroposterior axis, but also along the longitudinal axis. So you have here over here the notochord, which is influencing the ventral aspect, the basal plate, and then you have got the dorsal plate, which is under a different influence of the morphogenetic protein. But then these patterns that are developing along that segment, along the neuromeres, by these proteins will give rise to a specific appearance of these of the brain to the brain structure. So just to give you an example over here, you can see that this is a normal sagittal T1 weighted sequence. You can see the corpus callosum, and you can see the beautiful structure of the brainstem with the midbrain, the pons which is bulging, and the medulla oblongata. And you can see the relationship of the size of the midbrain to the size of the pons, and the position of the cerebellum in relation to that of the isthmus, which is this part of the midbrain with the junction with the pons. You can see the relationship of the fastigium, which is this part of the cerebellum, which is right in the midline of the dorsal aspect of the pons. And you can see how the medulla oblongata forms just below the level of fastigium, but well above the level of orbix. And this is the patterning that is determined by these various genes that secrete these morphogenetic proteins. And if there is any anomaly in that, you get these abnormal appearances. And once it's fairly easy to identify that the cerebellum itself is poorly formed in this patient, you can see how the abnormal patterning of the midbrain has occurred. As compared to that, the midbrain is thin, is elongated. The isthmus, which is this part over here, normally it is located at the superior level of the cerebellar vermis. Here you can see that the cerebellar vermis is much more at a higher level. So the isthmus is actually caudally displaced. The midbrain hindbrain boundary is now caudally displaced. And you can see that the pons itself has a much more dysmorphic appearance as compared to that. So this is a patterning that occurs as a background process. I've highlighted that, but it occurs throughout the process of embryogenesis. So what have I covered really within the last 40-45 minutes? We have looked at the various phases. We have seen the embryonic phase. We have seen the fetal period. We have not really talked much about a perinatal period, which is really a domain going into pediatrics. In the embryonic period, we have seen how the germ layers have formed. We have seen how the notochord influences the dorsal aspect and causes the neurulation. We have seen the ventral induction by formation of the 3 vesicles and subsequently the 5 vesicles. We have seen the fetal period where there is neuronal and glial proliferation, which occurs around the central canal, and then they start migrating. And we have seen as a background to all of this how the various processes, the morphogenetic processes, they influence and pattern the developing embryo. Not only have we seen all of these processes happening, what I've tried to show you is what happens when some of these processes do not behave, do not occur in the normal fashion, giving rise to various anomalies like the endogenous cysts that we saw, like the patients with the anencephaly and the myelomeningocele. We have seen the patients with neuronal migrational disorders with polymicrogyria and heterotopias. The postnatal development, as I said, it is sort of more into the domain of pediatrics, but it carries on for a good while all up to the adolescence, and that involves increasing formation of synapses. It involves the growth of the axons and dendrites, and also very, very important, it also depends on myelination of the white matter, which starts in the perinatal period, which goes on into the postnatal period. Finally, just a few words on what do I mean by radiogenomics. Radiogenomics is nothing but an imaging surrogate marker, which is a biomarker really, to predict what is the genetic profile of the tumor. And this is very important, especially in pediatrics, but also in some of the gliomas that we see nowadays, to try and see whether we can mimic what histologists determine, and whether we can look at it from the radiological perspective, so that we can what the tumor type is. And why is it so important? I mean, probably medulloblastoma is a very good example of why radiogenomics is so important, because we know that histology and genetics of any tumor, but specifically for medulloblastoma, is really a prerequisite to make a proper diagnosis. So it's not just important to say that it is a medulloblastoma, but it is important to say and classify which variety of medulloblastoma it is. Is it a sonic hedgehog type, is it a wind type, or a group 3, group 4? I'm not going to go into the details of that at the minute as to what the types of medulloblastoma are, but it's important to recognize that there are these histological types, and we might be able to determine based on our MR scan techniques as to what histological type it possibly could be, based on the location of the tumor, based on the presentation of the patient. And it's relevant because it can determine what the therapy is, and you can guide personalized therapies to these tumors, and eventually it will then be important for the outcome to that particular patient and prognosticate as to what happens in the future. So just in summary, really, what have I learned in my quest of the study of neuroembryology? I know it was quite a whirlwind tour. It's very difficult to pack everything in. We have not discussed very many things, but I hope I've given you a gist of how the brain evolves from a single cell into the growing telencephalon, mesencephalon, and rhombencephalon, as well as a cord. We'll perhaps spend a little bit more time of these individual structures when we look at the anatomy of the brainstem, of the cerebellum, of the spinal cord, and so on and so forth. But what is most important is to figure out that to understand the location of the abnormality, I really need to know where that abnormality is. So I need to know what the structure is of that area. But to understand what that structure is, I really need to know how it forms. Without knowing how it forms, I really cannot make a gist of what it is. And I think probably the most important thing I would like to suggest to you, which I have certainly found very, very relevant, is that I really need to look beyond my textbook, beyond radiology, to try and seek my answers in genomics and in molecular biology, so that I try and understand how the structure has evolved, not just during embryogenesis, but also how it has evolved over species. I think I would like to stop there, and we have got about 10 minutes of discussion, so I would be happy to take any questions if you have. Thank you. Apologize for the quality of the audio. I'm not really sure what happened, but hopefully I will learn more as we go along. Hopefully it will be a little bit better next time. So I think next week we are going to discuss, there are I think two back-to-back topics, one on the infratentorial compartment and the other one is going to be on supratentorial compartment. And in those, I won't spend more time on embryology because I think we have sort of briefed through that, but there will be some pertinent discussions to have. But the emphasis will be on a normal anatomy and really mainly on imaging anatomy based on CT and MR scans. So hopefully it will be much more clinically relevant for you. If there are any comments, if there is any way I can improve this discussion at this site, please do let me know. Okay, I think there are no questions, I think. So we'll meet again next week. I'll confirm with Dr. Tanveer, but I think we start on Saturday at the same time, 9 o'clock. So thank you for joining me.